All right, welcome everybody to the Go Wellness Collaborative. This is Kate Archibald, and I am joining you from sunny St. George, Utah. How's it going there in Denver?
It's going good, man. It's practices going well. We've had some really cool cases coming in. One of the things that's really gotten huge over here is we're doing a lot of SOT therapy with the complementary cancer program. Tara is just destroying that stuff and having some really incredible outcomes. So that's been awesome. We're still doing a lot of gut and infertility and hormone replacement. So man, it's been awesome.
That is awesome. So yeah, and we talked. It was I think two sessions ago. We talked a little bit on the SOT.
Yeah, I had this crazy case. We had this lady come in and she's teaches at a dental college. She's a dental hygienist by trade, but she's a professor. And post COVID, she was having this reflare of her Hashimoto's, and we did the labs, and there was some indication of like an underlying infection, and we did gut, and there was some stuff in her gut, and we got it cleaned up, and urinary tract looked good, and the blood labs, there was just a few markers we couldn't figure out, and it just speaks to the thoroughness of what we do. We had her on KPV and some of these antimicrobial peptides like BPC, and we were getting her energy level up, but she was having to supplement so much, and we didn't want to like blow up her thyroid hormone. So but she kept like maintaining this fatigue and just ruling stuff out. We had to go to a dermatologist, and they did this like full body, make sure there wasn't any like infections anywhere. We couldn't find anything, and said, I was like, hey, I feel like a dumbass here, but do you have any teeth issues? And she's like, no, Dan, my teeth are beautiful. And she does. She has like one of those perfect smiles. And I said, would you do me a favor? Would you at least go in and have somebody like really check out your teeth? And I remember years ago, we had that one, there was one of those doctors that he was treating a lot of cancer, kind of a bigger guy. The last time I saw him, it was at Snowbird. I can't remember his name. Chiropractor. He was doing a lot of IV therapies.
Oh yeah, yeah, yeah. I know exactly. He's in Oklahoma, right?
Yeah, yeah. And he told me about this Panorax imaging that they can do on teeth. So she goes in for this, and she calls me in a panic. And they found this infection that she was asymptomatic of. They had to pull 5 of her teeth. They had to
Oh,
do bone grafts. So apparently, post COVID, this oral surgeon has been seeing this reactivation of these latent bacteria in people's jaws, and it totally ate out the bone in her mouth. And it's been like 8 months, but once they cleared that up, all the thyroid symptoms went away, and it was like it's just one of those things. And that was crazy. Did I tell you about the uranium toxicity, lady? Oh
no.
my God, this is another case. So this is the second case I've had with
You
this.
you get the coolest cases by
Yeah, I
the
remember, it makes me think about like the first time, like I did my first stool test way back in like 2014, 2015. And my first one, it said that they contacted us, diagnostics did, and they're like,
I remember.
you need to like report this person to the department. And I called you, I was like, is this normal? Like, we never get
Yeah,
that shit. But
you get the crazy ones.
we had this lady come in with chronic fatigue, and we started digging in, and we did normal cleanup. There was obviously there was quite a bit of stuff, and really getting everything dialed in. And then when we got to her detox phase, we prep with glutathione, we're using the binders, using a lot of good stuff. We're not excessive about it, but we're cautious and very careful, and we're retesting. And she hit a wall, and we're like, that doesn't make sense with what we found. So we actually ran Mosaic has this total toxin metals panel. It's incredible. And we found massive amounts of uranium, and it seemed to be like damaging her mitochondria. So we put her on some dichloroacetate to ramp up her mitochondria. Started using like Mata C, the Humanin, SS31, methylene blue, and that was like maintaining her. But we had to get rid of the the uranium, and it was in the mountains here in Colorado. I'm sure any of the mountains, uranium is pretty high, and her
Yeah.
filter, her home water source is a well, and her home filter wasn't filtering out the uranium, and none of the other people in the family had it. So there was something unique about her inability to get rid of it. But man, it has taken 8 months and she finally feels like a normal person again. But we've just had her, you can't like leach it out fast. It's just like a slow process. So clean diet, had her on Z binder from orthomolecular. We've had her on some glutathione. We're just doing it really cautiously, make sure she's getting some humic and fulvic acids and just anything that helps bind alpha lipoic acid and calcium deglucarate. And she's doing really good, but it was crazy. So it was like, but when I first saw the uranium, like, what do you do for a living? Like, do I need to know something that you're not telling me?
Yeah. On the genetic test, what genetic test are you guys using the most of right now?
Lately, we've been using the 3x4 genetics, and like Jeffrey Bland and Sarah Gottfried are on their board. They have a couple geneticists. We really like it because it gives you the low penetrance genes. I remember when dirty genes came out. You remember we were all like, "Oh, we're gonna fix everybody," and I swear because people would ask me like, if you're accounting for like an MTHFR mutation and or COMT and these MTRRs things, like how abundant of a response are you getting out of people? And it was never massive. There might have been like 3 to 5% of our patients that crushed it when you like accounted for those gene variants, but nobody else. It was like so subtle. And now, they know that those genes, they don't work in a vacuum. They have these huge groupings. And a lot of times, if someone has an MTHFR mutation, but they make good amounts of choline, they're probably going to do okay, especially if they're having red meat and getting their B vitamins, but or certain B vitamins, of course. But the low penetrance genes, what they'll do is they look at all these genes, they identify all these families that you need to look at, and then they give you diet and lifestyle and supplementation based on all the different combinations of variants and where you need to be supporting. And then they identify the top 3 pathways that when you account for those, pretty much help support all the other variants. And so it's pretty awesome. If you've seen any of the functional endocrinology or any of the courses I've created through Go Wellness, a lot of this takes, a lot of this isn't going to be brand new to you. Some of this is going to just make a lot of sense, but there's so many different theories of disease, germ theory of disease, inflammatory theory of disease, even Sinclair, he's got the information theory of disease. What I've done is I've taken in, I call this our unified theory. And this kind of fits most of our practices, I think, and it takes everything into, and boils it down. And this is a conversation that I have with clients. And so, to some degree, it doesn't have to be excessive, but I use this. And then one of the other things I had put together was the scale of vitality or the health continuum. And now, Reagan and Kate are using that as well. And these things fit very, very well together. They're incredible. So what we're looking at here is, a person is the dark blue. They're going to be a combination of diet, lifestyle, exposure, and genetics. And over the years, I'm always looking at, I've talked about this when teaching at some of the Go Wellness events, is, there's about 10 major causes of disease. And outside of genetics, most of those are going to fit into exactly what we're talking about here. And so that's going to be those light blue circles. So like foods, bugs, stress, hormones, and toxins. And so when we're looking at that, the idea is understanding all these things. So I think, outside of the 9 markers of aging, when we're looking at 10 major causes of disease, those are going to be, just if you're curious, it's going to be nutrient imbalances. We're going to be looking at chronic infections, HPA axis dysfunction, hormone imbalances, toxicity, gut dysfunction, cellular dysfunction, immune dysregulation, musculoskeletal dysfunction, and then genetic errors or mutations. So we can kind of distill a lot of those down in this simple graphic and say, okay, you're the dark blue circles. You're all these things that are going to happen in your life. And then you have these like nuances that are going to be in the light blue. And so what are those? So On nutrition, of course, we're going to have deficiencies. We're going to have excess, like someone's got excess iron, for instance. But it can also be on the caloric load, right? Too many calories, not enough calories. Could be food allergies. We're just making sure that people have the bacteria that they're supposed to have on top of everything else. So this is a scale of vitality. And what's interesting and what kind of brought this together for me was, well, they did a study on thyroid. If someone has 50% of their thyroid removed, once that thyroid is removed, even after it's been taken out, if everything else is working pretty well, some people can live a normal life with no thyroid medication off of just 50% of their thyroid. So it begs the question, like, how dysfunctional does either the thyroid hormone metabolic pathway have to be disrupted, or how much damage has to occur into a thyroid before people become symptomatic? And what you'll typically find is about 70% loss of function in the thyroid before, or responsive tissue before people become symptomatic. That's how adaptable the body is. And that's why these labs are so incredible. When we explain this to somebody, this is usually what I start with on a lab review. Someone starts their life out and you're hoping that their body's functioning at 100%. And then what happens is over time, they start having the accumulations that we were just talking about on the molecular process of disease, right? Foods, bugs, stress hormones, and toxins, their genetics, these exposures. So what happens is it's very, very rare that somebody will have one precipitating event that just shoves them down this funnel, right? What happens is it's like a slow poison drip, and they slowly start sliding down this thing. They get a little bit of dysfunction, but the body is amazingly adaptable. We don't always feel that. And so as it makes those adaptations, that starts creating friction in the system, right? That's what creates molecular disruption. At a molecular level, when we're looking at these metabolic pathways, things get shifted and they're ever so subtle. And that's why preventative, we're doing these like preclinical disease states we're trying to identify with these labs, preferably, right? That's where we want to capture these people. They're having these molecular disruptions, these molecular levels of imbalance, and they're just ever so subtle. We start getting this cellular metabolic dysfunction, and we get oxidative stress and inflammation. That's going to be ever so subtle in the beginning. So these things build up. And then eventually, that's where we start getting these epigenetic responses. And if it's severe enough, or it's cascaded in a very particular area, we're going to start seeing tissue or systems dysfunctions. That's where we get off, and that's where those preclinical disease states occur. And then we move into disease. And so, he had this metabolic acidosis. His hormones were off, his estrogens were a little high, and his beta glucuronidase was high. And it's like, this was a gut-derived problem without massive symptoms of the gut. But we even need like the hydrogen sulfide and some of the reactive oxygen species being produced when someone has dysbiosis. And the lack of really healthy neurotransmitter production will drive or contribute to the fatigue. So the likelihood that we're going to be able to get this guy feeling great without fixing his gut, because it's the gut, we also had some micronutrient deficiencies. So his absorption was off. No symptoms of the gut, but it was contributing. And that's why this stuff's always like a spider web, right? This has been a really good model in that, it's like you said, it's like when you reduce someone's inflammation and oxidative stress and start improving like their liver and their gut, all these downstream things like their metabolism and their brain comes back on, and they start finding their cardiovascular systems working really well. It's like, it's interesting. There's probably a couple different variants someone could do at this. There's probably some things that could be added to it or taken away. I put all of our clinical data together and looking at some of our failures and what we were doing on a regular basis and what was working, what was not, along with some of the epigenetic data I had been studying. You peel a couple onions and it starts to improve the deeper things. And we usually tell people it takes about a month on each one of these rings to get some recovery.
Follow some of the East-West stuff. East-West Health YouTube, as well as Reagan Archibald just created that channel. So it's just at Reagan Archibald on YouTube. And hopefully you guys have an amazing day. We'll see you guys all next time. Bye for now.